Welcome back. We are answering your questions about the coronavirus and children with Medical Director for the Children's Unit at Moses Cone Hospital, Dr. Suresh Nagapan. Okay, you can text your questions. This is our last segment. We're going to try and get as many as we can in. This person is asking, my kids know they need to wear masks, but two of them are really too young to understand why. When is the right age to really talk to kids about what the virus can do?
That's a good question. I think it's really going to be age dependent. So, we don't recommend kids under 2 wearing a mask. They're just, too young. It's hard for them to take it off if they need to. So starting at age 2, you can start talking about it in a really simple way. Obviously, you're not going to talk about all the details with a 2 or 3-year-old, but you can start to talk about germs and what it means. And then as they get older, you can kind of get a little bit more complex. A lot of what helps when you're talking to kids is, especially once they're a little bit older, is letting them lead. So asking them what they already know about COVID and about wearing masks, and then asking them what questions they have. And that way, you can answer the questions that they have. The key is to really be honest about it. I think the temptation is to soft pedal a little bit, but especially with older kids, it's better really just to be upfront about everything that's going on. And obviously kids are pretty smart, so they can tell that they're not in school and most of society is shut down, so something is going on. So
right. Are COVID tests any different for children?
COVID tests are actually the same for kids and for adults. So it's the same swab, and goes in the nose and fairly far back, and so it really is the same. If parents do have questions about the test or want their kids to watch videos about what the test might be like, Children's Hospital of Philadelphia has a nice website that you can Google that has some videos and some information about what to expect when you get tested. They're really kid friendly.
This person is asking, have there been any children hospitalized for COVID at Cone hospitals in Greensboro?
We've had kids across North Carolina who've been hospitalized with COVID. So it's happening. Again, kids are much less likely to get sick than adults, but it's not zero. And that's something that we have to emphasize. So, sometimes you'll hear out there that kids are immune or kids don't get it, and that's not true. It's just that they get it less often. And when they do get it, they get less sick. So it's still out there. It's still a possibility. It's just not very common.
This person is asking, if you have 2 kids in daycare and they are exposed to another child who has tested positive for COVID, should you get your children tested and when?
That can be a kind of a complicated question, and it depends on how close the exposure was. It depends on if your child has any underlying issues that put them at higher risk. So my best advice for that is to talk to your pediatrician or family doctor about it, and that way you can discuss the specifics of that situation and decide, does it make sense to get a test or not.
Should you wash a child's mask more often than you wash an adult's mask?
No, you're about the same actually. And the more often you wash it, probably the better. Because if you think about it, if you're wearing that mask and all the germs and crud getting on your mask, and then you take it off and touch it, well, now you've gotten that stuff on your hand. So really what works the best is if you have a few masks at home that your child can wear, and then wash them each day. And so cycle through the masks and then wash one as you move on to the next one.
How easy is it for newborns to get coronavirus? I have family coming in from out of town soon to see our newborn, and I'm a little uneasy about them coming over.
That is an excellent question. Newborns can get it. We've certainly seen newborns with COVID. So what I would say is try to make that situation as safe as possible. The best thing you can do is have the family who wants to visit really kind of isolate for 14 days before coming to visit. That way, they haven't picked up anything and they're not going to spread it to you. And then when they do visit, all the same things that we've talked about before apply. So wearing masks, and then keeping distant, I think really makes a difference. Of course, it's really tempting to want to hold that new baby, but for grandparents who might be at risk themselves, the safest thing is to have that visit be distant, 6 foot distant with the mask.
Very quickly, if we can get this one in, this person says, my son wears bandanas instead of a mask. Is that okay?
So what I always say is, the face covering you wear is better than nothing at all. So if that's, what the only thing that your child will wear, that's okay. But there is probably a hierarchy of face coverings, and some are better than others. The surgical masks and the 2-ply cloth masks you see people wearing a lot, those are probably the best. Like a folded handkerchief is, not quite as good, and a bandana is sort of one step below that. There was some data from a study recently that looked at neck gaiters, and that actually, what they found was neck gaiters may be worse than no mask at all. What they theorized was all that sort of wrinkled fabric down here actually caught some of that virus and caught some of that air, made those larger particles into smaller particles, and then maybe increase the spread. So, so again, there's nothing that's perfect, but a bandana is okay. But if you can get them to wear the better kind of mask, go for it.
Gotcha. Thank you so much for your time and expertise. Thank you for sending in your questions.